Hello, my name is Dr. Hillel Mazansky, and I specialize in medical hypnosis, guided imagery, nutrition, and exercise. My mantra being how to live a longer, happier, healthier life. You will do that, my friends, if you purchase my new book titled Empower Yourself with Medical Hypnosis, available on Amazon.com. My website is drmedicalhypnosis.com, upon which are 26 different health hypnosis videos for your consideration. The blog contains a wealth of holistic health and medical advice. Today's health tip is titled What is multiple sclerosis, or MS? MS is a chronic disease that affects the nerves of the brain and the spinal cord. Sclerosis or scarring develops around the myelin, which is the covering of each nerve. The myelin becomes scarred, and therefore it is called sclerosis because multiple nerves are affected. People develop multiple areas of scar tissue, and it depends on which area is affected, whether it is the arms or the legs or the eyes. Nerve damage tends to cause weakness in the arms and legs, numbness, loss of balance, and muscle spasms. These symptoms may result in repeated falling or tripping. More than half the people with multiple sclerosis or MS develop eye problems, and it's called optic neuritis because the nerves to the eyes are inflamed. And this can result in blurred vision or loss of color perception, eye pain, or blindness. The problem is temporary and tends to last for a while and then resolve spontaneously. Some people develop slurring of speech or difficulty with swallowing, and that's called dysphagia. Some MS sufferers have mild loss of memory and difficulty with solving problems. They also exhibit difficulty with concentration. Some patients exhibit problems with their bladder control, and that happens when the nerves between the brain and the bladder are affected. Fatigue is a very common problem, even although they have a good night's sleep. Multiple sclerosis should not be confused with stroke, which is sudden of onset and is usually one-sided, whereas MS tends to be bilateral in both arms and legs, or legs. In MS, patients tend to have flare-ups. With times during remission, they feel fine. The other types of patients tend to have ongoing progressive type symptoms without relapsing. The reason why that people develop MS is that it is an autoimmune disease. In other words, the body attacks the nerve fibers in the brain and the spinal column. There exists a certain correlation in the regions of the globe where MS does tend to be more prevalent than others, especially in those areas of Scandinavia and areas that are far from the equator and Northern Europe. Some researchers feel that this is due to a lack of sunshine, and vitamin D might play a role in developing MS because of the sunshine. Vitamin D, as you know, is the sunshine vitamin, and some researchers have found that giving high doses of vitamin D in as much as 100,000 units a day have shown to cause a marked diminution in the amount of relapses. I certainly strongly caution you not to take this high dosage by yourself, but it should be under the doctor's direction, as blood tests have to be monitored constantly to make sure that you do not become toxic to the vitamin D. Multiple sclerosis tends to be more common in females than males. The diagnosis of multiple sclerosis is usually made with the history and physical examination. Special tests are sometimes done called EMG electromyograms, where the nerves are studied in the legs mainly, but may also be done in the arms, and MRIs of the brain and spinal cord are done, which reveal the scarring. Researchers have found that the disease is more active in the summer months than in winter months, and may increase with heat and high humidity. While there is no specific drug that can cure the disease, there are drugs called drug-modifying, disease-modifying drugs, which have been shown to be beneficial. During an attack, high doses of corticosteroids are used, such as cortisone, to reduce the inflammation and hopefully prevent the scarring. Certain types of pain medication are also used. If the pain is not so severe, over-the-counter medication may be used. Although if the pain is severe, stronger pain medications such as the opioids, such as Vicodin and Percodan, may be used. Antidepressants and muscle-relaxing agents are also used. Physical therapy helps with strength and with balance. Females may become pregnant with the disease, and actually oftentimes the disease improves during pregnancy. There is absolutely no risk of the child inheriting the disease if the mother has multiple sclerosis. So pregnancy is often a relief for the patients as the symptoms tend to improve. Something else that one can do to improve the symptoms is to exercise. Always speak to the doctor before you begin an exercise program, but walking for about 10 minutes a day and increasing slowly is extremely beneficial, as it helps relieve the spasm and builds muscle strength. Most people with MS tend to have a normal or near normal life, as during relapses they do not have any symptoms. Severe cases, on the other hand, if it's the chronic progressive type, they might find that they are eventually confined to a wheelchair and have difficulty in walking. I hope this has helped you understand more about multiple sclerosis. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip. Thank you.